The country has to accelerate its efforts if it's to meet the targets of the global AIDS strategy. That's the word from Health Minister Phaahla at the opening of the 11th South African AIDS Conference. eNCA's senior reporter Dasen Thathiah was there.
The 11th SA AIDS Conference is officially opened by the Health Minister, Phaahla. A number of important issues coming up, particularly around the decriminalization of sex work, as well as how far the country has reached in its fight against HIV/AIDS. But there are varying opinions on that state of progress. I want to now bring in Steve Letsike from SANEC. Steve, thank you so much for joining me. I think firstly a reaction, a number of issues being raised by the Health Minister here, essentially saying that he's happy with the progress and how the country has made up for, I guess, I could call it a backlog as a result of COVID-19. Your view?
Look, indeed, I mean, we have picked up from where we have left off. But there are some aspects, of our interventions as a country that we can do better. It doesn't mean that these things are not happening. We can just do better in that. And this speaks to how we want to make sure that people living with HIV have got access to treatment. And I think Minister was talking about the welcome back treatment. But most importantly, the welcome back treatment is not just about initiating, it's really about making sure that people adhere and we suppress the viral load, because that's how we get to the undetectable aspect of our treatment progress. He's also raised fundamental point around treatment pregnancy, which I think is valid, and we need to really address the violence associated with teenage pregnancy.
When you spoke, you mentioned how, and I'll stay away from the term because you mentioned that it's just communities that we are talking about here and there should be inclusion. Yeah. But do you feel that every community was represented in, for example, the plan, the National Strategic Plan, as well as the Minister's presentation of the expectation of the conference? No doubt. The NSP has gone into extensive consultation, and this consultation included various sectors: people with disability, people living with HIV at the forefront, but also young people, women, children, LGBTI, sex workers, and this is why this current NSP is called People's NSP. And People's NSP says that do things fast, do it with people, and turn the tide. And I think that has been a fundamental point. And I think we've expressed commitment to South Africans, but this commitment can't be felt at this level. It must be felt in the ground. So that means our government and all stakeholders of the council must go and implement and make sure the resources, all those monies that are committed, reach people. Closing thoughts here. What for you, in maybe 2 or 3 sentences, would mean a successful conference?
A successful conference is when we all understand the evidence. Scientists, social, biomedical scientists have gathered here. Activists have gathered here. Government and policymakers have gathered here. Now we have agreed, it's in the NSP. Now we just need to look at the evidence. What are the trends? What is happening? We understand our epidemic as a country. We have to act. And that's a successful conference, to say we see this collection of good stories. We see this collection of, not so good stories. But one thing, victorious South Africans is what will emerge from this conference, and collective effort. That's what the spirit we move in as South Africans and as responsible South Africans.
Very important thoughts there, Steve Letsike. Thank you so much from SANEC. In fact, ACT being the first word of the theme for this year's conference. The conference has attracted a number of delegates, not just from the country, but across the world. I'm Dasen Thathiah in Durban.